have one muscle, right? And then we have some ligaments. So you could say the left coracoid process, left radial collateral ligament, left ulnar styloid process, left brachioradialis, left trapezium, and left proximal radial ulnar joint were all negative upon palpation for pain, increased temperature, or swelling. Given that list, you couldn't talk about tone, right? You also couldn't talk about integrity given that list. So you could pull some of those things out and have a separate sentence where you talk about integrity, for example, for the radial collateral, well, not for the ligament, for the joint, okay? Or you can throw them all in. Make sure you have side and make sure the things you say you're palpating for make sense for those structures. So here, the example I just gave you, I shortened that list so that it's appropriate for all of them. If you have a pulse, you're going to have to pull pulse out of this list and have a separate sentence for that. Okay? For goniometry, so under range of motion on the documentation sheet, you would have left shoulder extension, active range of motion, 0 to 60 degrees. Right? For the next one, you're just going to have another line. You're going to say left, first CMC, abduction, passive range of motion, capsular end feel, 0 to 12 degrees. Pect minor, carrying angle is a tricky one because carrying angle you wouldn't normally document in the goniometry section. You would document that usually in observation. For this class, we're going to go ahead and throw that in the goniometry section, but remember, carrying angle is really just quantifying a posture. So you would say left carrying angle, 17 degrees. Okay? And then for pec minor length, that's going to go in the third section on that sheet under muscle length. So you would say left pec minor length, 4.2 centimeters. If your person doesn't have any tightness, you're perfectly allowed to use negative for those length tests. Okay, so we don't expect you to take a number if there's not a number to take. Amy?
When do you use negative versus 0?
So 0 means that there is physically no distance between, if we stick with pec minor, the posterior acromion and the table. So it's physically touching the table. That's very unlikely unless you have someone who's extremely thin. So then you would use the negative because it's the soft tissue that's limiting them. So you would only use 0 if the true measurement was 0. Then for documenting the manual muscle tests, you're going to have the side and you're just going to say left upper trapezius, 5 out of 5. Left extensor carpi radialis brevis, 5 out of 5. Left brachialis, 4 out of 5. Left supinator, 4 out of 5. And then you'll sign and date your note.
For that
right?
pec minor length test, do we have to do that thing where you flex the elbow and then come up to?
If your test just says pec minor, I'm only looking for the pec minor. If it's that I want you to do the coracoid differential, it will actually say coracoid differential
Oh,
on
sorry,
it.
you said that already.
It's okay.
For arteries, do we have to comment on like rate or rhythm?
No, because you're going to learn that in the fall. And so you would just say, patient, for right now, just say palpated pulse at the radial artery, pulse was normal.
Okay.
Would be fine for right now.